And I just also want to welcome everyone for attending tonight, taking time out of your schedule, and joining me and perhaps sharing, and we can all learn together. Uh, the reason I wanted to present this during this time is because I know there's a lot of concern in going back. What's going to happen? There's a lot of unknown, but we do know certain things. But what I hopefully will do tonight is encourage you, be positive, upbeat, and we still have the greatest profession. I want to thank Catapult, which I'm a member of, for this tonight, and let's get started. First of all, I want to recognize those that are putting their lives at risk every day. The first responders, the hospital personnel, the nurses, the doctors, the administration, and research. And the grocery store personnel. If you get a minute when you go to the grocery store, just thank those people out there. And also a special thought and prayer. Your heart has to go out to those people that have lost loved ones and not being able to be there at that time with them. Please remember them also. This has been tough on a lot of families. So please remember those in your prayers daily or just your thoughts. And be thankful to those that you can be thankful to. This is my email. I put this up now, and I'll put it up at the end. And my phone number. And I invite anytime, call me, email me. We're colleagues, we're professionals, we're in this together. But in call anytime you have, or if you have that, please email me. Or during our Q&A, we're going to try to get as many as we can. If we run out of time, each of me have those also. This is of Las Vegas. The reason I present this is some people have been to Vegas, and it's amazing how many do live lectures, which I do regularly. They ask, do you live on the Strip? No, we live in Summerlin, which is a little outside the Strip, and this is at Red Rock Canyon. It's about 7-8 minutes from our house. It's beautiful there. It's run by our national parks. It's not a national park, but it's run by our national parks. It should be. And my wife and I bike there, and it's just about 7 to 8 minutes. And this is Mount Charleston. This is where we go to get away. Sometimes about 45-minute drive. These are wild Mustangs, which I love dearly. They're very dear to my heart. I love these animals. They're beautiful, and they just roam free, and they're just so cool to see up there. This is the Strip 2 weeks ago. It's unprecedented. We are in unprecedented, uncharted waters. There's no question about it. My wife and I went down there. This is an overpass. We took a picture, and I don't know that I will ever see this again in my lifetime. I hope not. This pandemic has been tough on all of us. And, again, our hearts go out to those that are out of work, us as dentists, and those, this is tough. It's been really tough. So this is what the Strip looks like right now. This is where I'd rather be. This is in Napa. This is my love. I love those grapes. I love the wine. And we love to be there. So now the reason I show this picture is it has some relevance to what I'm going to talk about. I grew up in a business, a family business. My parents owned the largest Italian restaurant in Southeast Michigan for 35 years. And if any of you have grown up or been part of a family business, you know that no matter what age you start working it. I started rolling pizzas when I was 9 years old, staying on 2 Coke cases. Now, what these pictures are Super Bowl Sunday. We have a party at our house, Bowl Sunday. Upper left is Brigitte, the lower left falls, and it's of course all in the gravy. You can't have a party without the pie, pizza pie, and stuffed shells at the bottom. And to top all that off, you got to have the homemade cannolis. This is a 135-year-old family recipe, and I'm sworn to secrecy by my dad. I was able to share it with my wife and kids, but we're sworn to secrecy. So we have a good time on Super Bowl Sunday. The reason why that's relevant is because my father taught me certain business skills as I was growing up. As I mentioned earlier, thank you to Catapult for hosting this tonight. I am a Catapult member. We have about 50 to 60 members, about 24, 25 of us that lecture. So if your study club or your dental association or your dental society is ever looking for someone to come out and speak, look up Catapult Education. A number of our members, we speak on different topics. For instance, my topics are usually dental materials, occlusion, worn dentition, how to restore it, diagnose it, treat it, and smile makeover. But I will tell you, tonight's topic is my favorite. It really is, because it brings back to things I've learned all my life, how important business is in dentistry. So this is a little disclaimer. These are the companies that Catapult works for. We do an evaluation of products. They ask us to do this evaluation, and we give them our response. So we get to use the product and be honest with them. So this is just a list of it. Let me recommend that many of you may want to get your cell phone camera ready tonight, perhaps, and take photos of some of the slides that I'm going to present. So to get started, the state of business in dentistry upon return. What do we know about that? Well, what do we know to expect? You know, we're not sure. We're truly not sure. As I mentioned earlier, we are in uncharted, unprecedented waters. There are certain things, though, that we do know, and that is it will not be business as usual. For us to go back and to see patients back to back can be very dangerous, can be very costly. I think one of the things that's going to come out of this is that we're going to be more conscious of infection, more conscious of viruses, more conscious of the safety of not just ourselves, but our team members and most of all, our patients. I think one of the questions that may be asked by many patients as we return is, what have you done different since this COVID-19 to make it safer for me in your office? I think that's a huge question to consider. Many of you have been bombarded with, most of us have been bombarded with seminars and webinars during this time, and it's great for our CE, but also to get educated. Let me just encourage you that you take a look at Midway, MIDWAY, edu.com. And Dr. Lou Graham, who I practice with in Chicago, he has put together, Catapult has a education relationship with Midway EDU, and Dr. Graham has put together different segments called the new norm. And take a look at that, and you will see a lot of your questions that you may have be answered. So I'm encouraging you to do that. And on the other hand, I also look at it, perhaps it's one of the best times to make changes in the office. You know, we all want to make changes, but it's painful. The old saying that the only one that likes changes is a baby. But I look at it again as the glass half full. It is that opportunity that you have been waiting for to make those changes, whatever those changes are. We do know one thing, that change is constant. And we also know if we decide not to change, then change will change you. I think about when I got out of dental school in 1980, and yes, I am starting my 41st year in dentistry July 1st. And I will tell you something, I'm more excited about dentistry right now than I've ever been. And I really mean that. Basically because of the technology and the treatment due to that technology that I am able to deliver to my patients. We can get out of the guessing game, and we're going to talk about that as far as diagnosis with 2D to 3D x-rays, and we'll talk about that in a little bit later. So I'm going to start off today, and I'm going to present a fairy tale. Okay? The fairy tale, the definition of a fairy tale, according to Mr. Webster, is a fairy tale is a fabricated story, especially one intended to deceive. Thus, if it's intended to deceive, we would all assume that could never happen to dentistry. But let's see, in dentistry. The name of the fairy tale is The Sunday Evening Blues. And this is how it goes. Early Sunday evening, sitting on the sofa, just finished watching the last NFL game for the day. Then it happened. It happens every Sunday, the Sunday Evening Blues. You know the one I'm talking about. Your thoughts turn to the week ahead, and tomorrow is Monday. Dr. Joe is the most popular dentist in town. Excellent clinician, patients love him, and thus the largest practice in town. Dr. Joe should be in his glory, and most dentists can only dream of having his practice. 23 years in private practice, and the office is located in the most modern, beautiful medical building in City Center. Located on the top floor with a beautiful view of the city. Every up-to-date digital equipment possible. Patients 4 days a week, and the office production has increased substantially every year. Dr. Joe has a draw of $15,000 every 2 weeks per his accountant. He never dreamed of this, yet he is miserable and should be on cloud 9. The weekend was a disaster. Joe and his wife, Joy, had blow-ups every day. Joy is his second wife. As usual, the blow-ups were over money. Should we add a gym onto the multi-million-dollar house, even though they belong to one of the nicest gym workout facilities in the country at the cost of $675 a month? The quote from the contractor was equivalent to 2 years of tuition at a private college. As Joe looks at his personal finances, he realizes with hardly any retirement contributions, he will be working until he is at least 78 years old. Alimony payment to his first wife and private college and car for his daughter from his first marriage. The interest-only payments on his mortgage with a second mortgage on the multi-million-dollar house, he realizes he is not building any equity. The alarm rings Monday morning for Dr. Joe to get to the gym for an hour workout with his personal trainer. He is miserable and hits the snooze, not thinking of his last physical with his concierge doctor who increased his BP medicine and jumped his daily Crestor to 30 milligrams per day. Finally, Dr. Joe makes it out the door and heads off to the office in his newly leased Bentley Sport convertible. He goes through the drive-thru at Coffee Depot. Short on cash, he pays with his Black American Express. With 3 children from his second marriage, the oldest in his second year of private college, the second child graduating from high school this year and college next year, the third child just turning 16 and getting her driver's license. Joy is pushing to get another new car for the 16-year-old so the two at home will not have to share the car. Finally, at the office, 15 to 20 minutes before the morning meeting prior to seeing patients, as he does every morning upon his arrival, Dorothy, his office manager, has the week or the day before his office production, collection, and accounts receivable. His throat drops to his stomach. Collections are only 58% of the accounts receivable are out, and the accounts receivables are out of sight. First message on his personal email from his private banker: your personal account is $6,000 overdrawn. Yet in his wallet is 2 paychecks, a total of $30,000, and yet not enough cash in practice to cover the checks. 2 months ago, he had to ask the office manager and the 2 hygienists to hold their paychecks for 1 week. Now, of course, this is a fairy tale. Therefore, it certainly couldn't happen in dentistry. But the truth of the matter is, it does happen in dentistry, and it's sad. So tonight, if you have any part of that fairy tale, hopefully I can give you enough information that will help you through it. So just remember, if nothing else, it's not how much you make that counts, but how much you keep. So if it's measured, it is a fact. If it's not measured, it is an opinion. We have to come to the realization, if we don't already, that dentistry is a business. And that it's a matter of fact that we have to have certain measurements. So let's take a look at some of this and how perhaps we can help each other in this. How did the most financially successful business people become successful? Number 1, and how do they measure? They have a great financial planner. Several years ago, well over 20, I met a gentleman that was a financial planner, and he was recommended to me by a friend. And he sat down with me and he said, I just have a question for you. At what age would you never have to depend on dentistry financially? And I said, I never thought of it, but I think about the age of 57. And he said, fine. And I will tell you that did not happen at 57, but it happened at 58 and a half. This is the name, and the reason I post this is if you're looking for a great financial planner, it's a boutique practice. You can email me. This is Cater Group, and they're in Lenox, Massachusetts. And this is a boutique financial planner that does it personally, okay? So I'll take a few minutes here, you can take a picture. If you're looking for someone, I would highly recommend David Cater, his brothers, and their family. His mother started the business several years ago. They were just voted the second boutique financial planner in the United States. They're incredible. They're honest. And I know if something happens to me that my wife, and we're like family, you're treated like family, my wife, Cheryl, will be taken care of. I don't have to worry. So they will sit down with you, take your personal assets, look at your personal financials, talk to you about your spouse, children, being employees in the practice. They'll map it out with you and your accountant, and they'll make a plan for you. So the first thing is a great financial planner. I would like to have you get a private banker. The reason being, it's just like Joe, he has a private banker and he can say, hey, Joe, can you transfer? You want to have a personal relationship with your bank. The next is an attorney. I presented this seminar yesterday and I made a comment and someone said, perhaps you should check this with your attorney. And my attorney, who is in Grand Rapids, Michigan, where I practiced 26 years prior to 17 years coming to Las Vegas, he's an HR specialist and he's a health contract specialist. So a great attorney is also in order to seek this financial success, a person to have a fantastic accountant, an accountant that understands dentistry. And we're going to talk a little bit about monthly statements and P&L statements in a little bit, but an accountant is necessary so they and your financial planner can plan this out and also make the best decision on income and what to do with that income. In a marketing plan, we're going to talk about vision in a little bit, why it's important to have a vision in your business, your dental practice. The one phenomenon that is consistent in every successful business person is they're fantastic leaders. There's no question about it. If you look at all the financially successful people that you may know, they're great leaders, okay? And as John Maxwell says, who is an incredible author on leadership, everything rises and falls on leadership. If you look at history, if you look at business, how true is this? That whenever you see something that has been successful, if it whether be Apple, Microsoft, whatever it is, every great business has a great leader. And your leadership skills determine the level of your success, and more important, the success of those around you. There's no question. So the question of the day is this: as a dentist, have you been a leader or a manager? There is a difference. And I want to share with you what that difference is. Many offices have office managers. Management is the process of assuring that a program and objectives of the organization are implemented. It's the office managers. It's those managers that make sure certain things in the office take place on a daily basis. Leadership, on the other hand, has to do with the one casting the vision and motivating the team. The leader is the one who says, hey, let's reach out there and do this. Let's plan for this. This is the future of this practice. This is where we're going to go. And that's communicated to the team. The leader is the one who plants the vision. So there's three critical areas of leadership that provide the view and the rudder for your business. Number one, as I mentioned earlier, the leader has to plan the vision. And the primary role of the leader of dental is to plan this vision. Put simply, you decide as the leader, as the dentist, where the business is going. Excuse me 1 minute. There we go. Is going. Without a vision, you and your team will wander aimlessly. Where's your business heading? I have been in so many dental practices where people just show up with no vision. They just show up. It's a paycheck. It's not a career. The future is unknown. And I find that very sad. So as a leader, we want to be leaders. Where is your practice heading? And this is great lead. It comes from passion. You have to be passionate about you as the leader, as the dentist. For those who know me know how passionate I am about dentistry and how much I love dentistry. Passionate about a lot of things. There's a lot of people that you can think of that's passionate. I think of Tom Brady and Bill Belichick. Like them or not, are they passionate about what they do? You better believe they are. They're great leaders. They're passionate. They didn't win 6 Super Bowls by not being passionate. And just to go over real quick, a content of a vision, if you need that help, it should be the following. Who are we? Number one, who are we? What do we do? And for whom do we do it for? A little hint there is for those who value your level of care. One of the things that I do with new patients is I interview them. I interview them to find out if this is a good match. Over the 41 years in dentistry, I have found that not every patient that walks through the door in the office is a good match. It may be a personality, whatever it is. It may not be a good match. And we don't have to treat every patient that walks in. Now, if someone's in pain, we're going to take care of that. But we want to make sure that those people that we're doing what we do, they value what we do. And where and what are your goals? Goals, I'm huge on goals. So vision has to be, where are we going? What do we do? Who do we do it for? And what are our goals? Create that environment. And when I say create that environment, create that vision and dream big. Don't stand back. Maybe, and again, this is a perfect time to do this if you've never done this with your team. When you go back, blow that team away and say, hey, everybody, I've had time to think about this. This has really come home to me that I've never taken the chance to share with you my personal vision and the vision that I want, where I want this office to go. Take that time to do that. Number two, planning makes a difference. So number one, we had vision. Planning makes the difference. If you think of anything that has been successful, there were plans. These plans were laid out and they were shared by the team around them. You need to establish goals and they need to be detailed and incrementally, and you have to be able to incrementally achieve these goals. Baby steps. With clear goals, progress and success can be measured. What are your goals? Goals have to be written down so that you can visit those goals. If you just fly by what I call fly by the seat of your pants, they have to be written down. They must be written down so that you and your team can visit them. Your practice is the vehicle. The dental practice, your business, is that vehicle in which you can achieve those goals to make it possible. And number three is growth. Number three is growth. Dentistry has changed so much. You know, one of my favorite sayings is, if you don't change, change will change you. We as professionals, we're responsible to grow. And we're responsible to our team that they grow also. There's nothing more rewarding than seeing my team grow. To be able to go from point A to point B with a smile on their face. Something that I really encourage is for doctors, the leaders in the office, to sit down with their team and say, share with me, how would you like to grow? What is it that you would like different? What is it that you're trying to achieve here? Show interest in that. Develop a passionate ownership relation to the business. Dentistry has grown so much in the last 40 years, in the last 20 years, in the last year, as to what is possible for diagnosis, for treatment. I mean, you know, you take a look at it 40 years ago when we were doing amalgams and gold, and today we have adhesions and all kinds of materials to make it available to diagnose, treat, and give our patients the very best treatment. Growth is huge. CE, whatever it is, growth is huge. So what do leaders take action on? To summarize this, leaders speak about the future, and they are constantly working to make that happen. They're planting that vision. Leaders continuously take steps to develop themselves and their teams. This particular aspect I have found when I go into office is commonly weak and missing. Doctors, we have to take care of our greatest asset. You're going to hear me talk about this a lot tonight. Your greatest asset in the practice is your team. I could not do over the last 40 years what I've been able to achieve and do for my patients without a fantastic team. And I've had some fantastic teams, and I'm very, very happy with that. Leaders are constantly looking for new and better ways to make the future happen. Thank goodness. And thank goodness for those manufacturers out there that make that available to us. So I have some good news and I have some bad news. First, the good news. If you own a dental practice, I want to commend you for owning a dental practice, for providing jobs for some or many people. You have put your behind on the line out there. The bad news is, not too bad, you own a business. You have to treat it like a business. You must treat it like a business. That is reality. This is how we pay our team. This is how we pay our bills. And this is how we get paid. This is our reward. In money, I want to let you know, money and collection, it's just a measurement. It's the reward that we get for providing a service. And we are in a time service-oriented profession. So don't ever be ashamed about talking to money with patience. You deserve, with your education, to get paid fairly, and you deserve to provide a service that you do get paid for. So, as a business owner, you must learn how to manage your money and how to control and operate your practice like a business. Now, there's a profit and loss statement, as I mentioned earlier. There's a bottom line. Money comes in and goes out. People get paid and bills are paid. This is business. This is reality. And this is what we deal with every day. So how did this all happen? I mean, most of us went to undergraduate for 3 or 4 years, some 2 years. We went to dental school for 3 or 4 years, and we graduated from dental school. That's how it happened. We graduated from dental school, and what happened? We became an untrained CEO. Now, early on, when I showed you that picture of food, and it's getting near dinner time, I told you that this was relevant to what I was going to talk about. I had the advantage of growing up in a very strict Italian business, that my father was very strict about certain things: paying your bills, your last to be paid, taking care of your team, making sure that your team was taken care of. The greatest at learning, they are your greatest asset. You can't get from point A to point B without a great team. So I had a little bit of an advantage. I understood FICA. I understood unemployment. So I had a little bit of training, more than probably a lot of you. For most part, we were untrained CEOs in the so-called learn on the job. So there are certain things in dentistry, in any business, that are myths and facts. They are real or perceived. So I just want to cover some of those for a minute, and then we'll get into the nuts and bolts. Myth number 1, I will live forever. I have plenty of time for planning. If there was ever a time in my professional career that this hits home, it's right now. I know so many dentists I have talked to, not just dentists, physicians, business people, that says, oh, the last 10 years of my business, I'll put away for retirement. I want you to think about this. If you practice dentistry for 30 years and you wait until the last 10 years, you have lost 20 years of time that cannot be made up. I don't care how you put in, you cannot make that time up, because there's a thing called compounding money and growing. You cannot make that time up. And we don't know what lies for us in the future. You look at what's going on right now, uncharted, unprecedented time. No one would ever dream of this. So the truth of the matter is, life is full of choices and changes. We all know dentists that not only were their life cut short, unfortunately, but their careers, their disability, that was cut short also. So my encouragement to young dentists, to dentists no matter where you're at, start putting away immediately. You have to plan. One of the first lessons my father always taught me is first thing you do is save, save, save. Myth number 2, if I just produce more, life will be fine. It is difficult to outrun your overhead. That's the truth. By producing more doesn't lower your overhead. Myth number 3, I just need more new patients. Before we went to computers, for those of us who've been at it a while, we used to say there is more dentistry in those charts sitting on that shelf to keep me busy for more than a year. And that's true. The truth of the matter is we need to improve our sales. Now that may be offensive to some dentists when I mention sales, but let me tell you something. We need to educate our patients in the urgency to have treatment taken care of. Saying that, if you put a patient and they feel the pressure of your sales, they will walk out of your office a lot of times. They'll feel like you are pushing something on them. You're putting the pressure. And the truth of the matter is, the dentist, in most cases, is the least trusted in the office because the patients know you have a vested interest. If you don't think that's the case, you think about the times when you did a recare appointment and your hygienist had recommended a crown and you verified that when you leave the room. How many times have you heard the patient or the hygienist tell you, the patient asks the hygienist, do I really need that? Is that something I really need? So I just want to tell you is that you have to make sure that your sales skills, when I say sales skills, that you share and educate the patient the urgency. And on the other hand, everything we do is elective because people can live without teeth unless there's infection involved. They have a choice. So educating, having that relationship with that patient is important. Myth number 4, overhead is less than 50%. What I have found is majority of the dental offices don't know their true overhead. And after tonight, I'm going to share with you how to figure that out. So, facing the truth of a practice out of control financially. The following points that I'm going to bring out here are points that I have accumulated over years in talking with friends, visiting dental offices, consulting with dental offices, and just taking a look at a practice financially out of control. And this may be hard for many of us listening tonight, but there is a way out. There is a way to take care of this. And after tonight, I hope you have this. Symptom number 1, if your overhead is 67% or greater, you will never achieve your financial goal. This is so true. After tonight, you will realize why this is so true. If you have an overhead of 67% or greater, you cannot financially be successful in your practice, put away for retirement, and pay all your overhead bills. Number 2, and take home a decent salary. Cannot pay your payable bills. Practice out of control. Practice is pre-spending 98 cents of every dollar it takes in. I like to know what my fixed expenses are at the beginning of each month. If I feel the pressure, if I know that I'm pre-spending 98 cents on every dollar it takes in, and I have to practice dentistry with the understanding that I need that patient to accept that treatment plan, that's not a good thing. That is not a good thing. That is not a way to practice. Those patients will feel that pressure. Live from paycheck to paycheck. I don't want my team, I don't want me as the leader and dentist to have to do that. But that is reality, and I know it, and it happens. Personal funds are mixed with practice funds. Not a good practice. Not a good business practice at all. Your accountant would point you in the right direction. Don't pay taxes on time. Continue. No personal savings to invest. Cannot fund any retirement plans. High stress. Everyone on edge. Environment is tenuous and not a fun place to work. I can tell you that one of the goals that I always have is to have fun in the office. It really is. Now, I realize there are those moments of stress. There are those moments that things are not going the way you want them to. I'm not naive to that. But the bottom line is, at the end of the day, at the end of the week, did we have fun? Do we enjoy what we do? I never want a team member that doesn't enjoy being with me or having fun. It's important to have fun. Do a great job. Be serious about our profession. But we got to have fun. You got to love what you do. And sometimes it may feel like this, and it may feel like this. This is what I try to avoid as the leader in the office. Frustration, pressure, work to get done, finances, concern, and just a lot of stress. This is what I want, and hopefully we can avoid. About 10 years into practice, I was not enjoying dentistry as a professional. I was going from room to room on roller skates. I felt that I was a good dentist, but this is not what I went to school for. This is not what I became a dentist for. I wanted to be able to treat my patients the way I wanted to be treated. And that was one patient at a time, take my time, be fairly compensated to provide the absolute best dentistry that I could. This is not what I wanted. My health was poor. I thought, what am I doing in dentistry? So I made a choice. I made a choice 30 years ago that I was going to see one patient at a time. I made a choice that I wanted to be compensated. I wanted to compensate my team. I wanted to have the best team in my area. I wanted other team members to want to work with us. And I just wanted to be very proud of our office and our professional. So I made that choice, and it worked out, I have to tell you. So what needs to be done? How do we get our office under control financially? How do we plan for the future? How do we have this vision? Yes, there is a solution. So let's get started on the solution. Number one, we have to business plan. We talked about that earlier. We have to have that vision. We have to business plan. We have to have goals. We have to sit down with our team. We have to plan this out. I want my team involved. Again, your greatest asset. So you have to sit down and have a business plan. Where am I going in the future? What is it? What is the business plan for this practice? How do I want my patients to be treated? What is my education goals? What are my financial goals? So it has to have a business plan. I used to prepare, and I prepare a business plan annually before the year starts. I would start about October. And you have time now. We are getting back. We shortly will be getting back to dentistry. Will it be dentistry as usual? No. But we have time right now to plan for the rest of the year. Again, if you've never done this, take some time. And I'm going to show you a step-by-step process how to do this business plan. The necessary steps. Get practice. Number one, get practice under control financially. I can't stress this enough. Financial pressures are incredible. They cause heart attacks, poor health, strokes, on medicine. It creates pressures in marriages, relationships. It creates stress in office. Number one, get the practice under control financially. And involve team with practice planning. A lot of times I've spoke with many dentists that said, why should I involve my team? Again, they're the greatest asset. They're the ones that get you where you want to go. The greatest asset. They should be part of planning. They have ideas that are incredible ideas. Establish written practice goals. Part of the vision. Every year, we would write new goals for our office. Involve team with financial aspects of the practice. But I don't want my team know what we're doing financially. Guess what? They know what you're doing. I'm not talking about salary. They know what the practice is doing financially. They're the ones that collect the money, that fill out the insurance, that collect from the insurance, that collect from the patients. They know. This, at the end of this webinar, you will do it daily if you follow my steps. This is talked about daily in our morning huddles. Make projections for annual gross production collections for the coming year. We do that at our annual meeting, and we're going to go through that, and I'm going to show you. So these right here are the necessary steps that we have to get. Involve your team. help them make financial aspects, help them get involved in the financial aspects of the practice. Have them help you with projections for annual gross production. We want production to equal collections, but I also realize that insurance is involved here. So here's how it goes. Everyone, this is the fun part. So every year on the first Thursday, again, I start in October, but every year on the first Thursday of the new year. So for example, I've selected here January 2020. Okay, January 2020. And usually we are out of the office Christmas, a couple days before Christmas through the new year. And in this situation, we would not have returned to the office on Monday the 6th. So Dr. Tomaro's first Thursday of the year, state of the office address, New Year planning. This is where we do the planning stage for that year. Now understand, I started this in October, and I lay subtle hints like, hey, give me some ideas what you guys would like to do before we get to this meeting from my team members in our twice a month office meeting, if we have an office meeting, or we in our morning huddle meetings. So we talk about that. So I take those ideas. At this meeting, we plan the whole year out. The first thing I do at this meeting is I walk in and I give each team member their annual compensation and benefits report. I'm going to leave this up here for a second before we fill it in, because I will tell you, most doctors, most dentists, most leaders in the office do not realize what an employee or a team member really costs the office. They only think about the salary. So this may be shocking to some of you out there, and it may surprise some of you out there. And if there's team members that are listening, I'm very thankful. So here's how this works. Each team member gets this annual compensation. And what happens is that they keep this confidential because salary and wages are confidential. That's my own feelings, and I know about the National Labor Relations Act, and also aware of at-will employment, but I always share with my team members, this is a private matter. This is a serious private matter. It is between you and the doctors. And whatever your office, whatever your attorney, HR attorney says, whatever the national, I understand that. I truly do, and I'm aware of that. But this is a very precious relationship. It is, and I've never had an issue with it because they realize most people don't want other people to know what they're making, but it happens. So this is the annual. So let's go through this a minute. So this is just year 2016. Hygienist Sue is paid a salary per day. Now, one of the things that has come up in previous presentations of this is that only office managers and doctors can be on salary. But let me tell you how this works. In this situation, Hygienist Sue is paid so much per day based on seeing patients from 8 to 5. And this we saw patients from 8 to 5 Monday, Tuesday, and Wednesday, and from 7 to 2 on Thursday. That's 31 hours. My compensation, my salary, or whatever you want to call it, per day, I like to use the word salary because I like fixed expenses and figuring out budgets, was based on 36 hours. So each team member would clock in every day. So that takes care of the part of the law that says, hey, someone's working overtime and you're not compensating them. That covers your butt, okay, so to speak. So the salary, the daily, you can figure it hourly, based on 8 hours or 8.5 hours, based on 36 hours a week. That's what I'm referring to as their salary. So Sue's compensation that year was $74,300. Okay, this is true. And so what happens is that as you go west, for those hygienists or those team members or those doctors listening east, as you go west, hygiene salaries are a little bit more than they are east. So then her bonus that year, and we're going to talk about bonus, doctors don't get worried or freaked out. was $7,500. Here we go. FICA. The employer has to match the employee's FICA, $4,886. FUTA, federal unemployment, 6% in 2016 was $4,728. Unemployment, state unemployment. In Nevada, you usually start out about 2.75, you stay there, $2,167. Now, I just want you to look here a second. Take a look at already in your mind, add up where we're at, okay? This is what I'm saying. Most doctors, most leaders don't realize this. Workman's comp, $650. Every year, our team, we went to the midwinter meeting. We would travel. We had a ball. We would fly in on Wednesday. We'd stay till Sunday. We had, just to bring the team together to enjoy. We'd have meetings. We'd talk about how the day went. If you wanted to take a class, if you wanted to shop, that was fine. But the whole thing is that we wanted to do something together. $3,400. Dues and subscriptions, hygiene magazine, $120. Usually disability, I never covered. That they had to do themselves. Health insurance. A lot of times you may have a team member that significant other has a better health plan. But in this situation, we put in $8,200, okay? Dental care. I never charged my team members dental care excuse me while I get a drink, and it's water. Dental care, lab cost. Now, sometimes, again, the significant other may have a dental insurance. Use it to your advantage, okay? But basically, if there was a lab cost involved, just cover my lab cost. Christmas bonus. I gave everyone $1,000. Just uniforms and laundry, $2,600. We had a laundry service going by the CDC guidelines. They had to be laundered a certain way, and it was right across the street from our office. So it worked out fantastic. Notice that I crossed out sick days. Whoever came up with getting paid for sick days, I never have understood that. But still, instead what we did was I gave each team member $400 a quarter for every day they were not sick. In other words, I paid them for well days. If they made every day that we worked in that quarter, I gave them an extra $400. And they loved it. It worked out great. $1,600. Notice that number 2, retirement, $72.99. The reason why I was big on retirement is multiple. It holds team members together. We had people wanting to work at our office because something that was very important to me as the leader, as the doctors, I wanted my team taken care of. I wanted them to have a nice retirement. Financially, huge advantage for me and what I could put away in my retirement. My wife was employed in the practice. She took care of the decorating. We worked that out. Again, my financial planner and my accountant worked it out. And it's different for each one of you as to the plan that you have. But it allowed myself to put away a huge amount of money for retirement. So you take a look at this, and I will be willing to bet that majority of the people out there had no idea this is what is involved in this hygienist's salary. That is the true salary that we as dentists pay our team members. Take a look at that. And perhaps you have never figured that out. But this is the first thing that I gave, whether it be an assistant, I would do hers or his. If it was the receptionist, the front desk, I would do theirs and break it down before this. And this is the first thing I gave to them, gave them a few minutes to look it over. Please, if there's any questions about, please, during the Q&A. So planning for the year. Something I realized over 41 years of dentistry is this was our office in Las Vegas. And something I come to realize early on, we had 4 wonderful children, college, the whole works, is that life goes quick. When I realized that this building, this office was going to be there, those pictures on the right, they were not always going to be there. And let me tell you, and you've heard this many times, it goes fast. There was only a short period of time that my wife and I, and by the way, we're celebrating 40 years this year, that my wife and I had any influence, not that we did, but that we had any influence on our children. Not only just influence about things in life, but also teaching them, encourage them, being with them. One of the things we miss more than anything right now is we miss our children. We love them dearly. But I realize this time goes fast. So it goes that fast. That was about 5 or 6 years ago. Obviously, we're having our first wedding this summer, 8/8/20. Sam's standing up in the background. He's 37. And by the way, if you still have children at home, we figured out how to get them out of the house. You just treat them bad. Ours stuck around too long because we treated them too good. And this, my sweetie, luckiest woman in the world, I always say, of 40 years this year, she's always been there for me. And we've had just such great times. We've been blessed. We've had our hurdles, but I could have not had a better life partner than that right there. So I realized how important time with them was and how important it still is. So the first thing I would do is, after I presented the annual compensation, I came in with my calendar. Now, many of you may have this calendar in your office to mark days off, who's going to be off, whose birthday, on and on. But this is how I started this meeting when we went into planning the year, financially and days working. So what's the first thing I did? As you can see here, I have arrows that have blocked off days. What did I learn? I plan my work days around my vacation or time out of the office. That's how I planned it. Again, to realize that office is always going to be there. And not only that, it helped to be efficient in the office. So one of the things I figured out over the years is, how many days do we work in a year to be efficient? Now, I was blessed to be in a practice, to have a practice that in Las Vegas, I had the opportunity to do a lot of cosmetic work on performers. And so there are certain things that we had to do that perhaps, we had to see someone on a Saturday, a performer, or during when they're dark days, when they're not performing. Or we had people coming from out of town to treat for full mouth reconstruction, whatever it is. Those are exceptions. So what we figured out in our office is that between 132 and 138 days of in-office working, we were the most efficient. And it's true. If you look at your efficiency, that you don't schedule just to fill the schedule, that you schedule to goals each day, financial goals, and you do block scheduling. These are the days that you're the most efficient. So what we did is, again, to go back, you take a look at those. Okay, green days, I'm using my pointer here, green days was spring break. Our children growing up in Grand Rapids, Michigan, Grand Rapids school system, all of them, the first full week of April was spring break. So we could always plan. You see pink down here. Pink is obviously my anniversary. So, of course, if I want to be married 40 years or longer, I certainly cannot forget that. And the rest of them is either my love is duck hunting, pheasant hunting, fishing, was built around that. So we had 132 to 138 days to fulfill our financial goals. So we take a look at 132 days. And this is where the team in the financial planning aspect came in. Okay. Now, to go back, for instance, if I had a team member, and I did, that had children in school and they wanted to take a summer vacation, we always worked that out. That was never an issue. That was never an issue. Because what happens is that I go fishing, but we had to make those days up. We had to get at least 132 days in. Financial planning. What was our goal in 2016? What was our financial goal for that year? Our financial goal was $1,400,000 of collection. So how did we make that happen? The old saying, how do you eat an elephant? One bite at a time. That's how you eat an elephant. So what we did was, if you divide 1.4 million by 132 days. Your daily goal was $10,606. Now, there may be days where you only do 5,000. There may be days where you do 25,000. But that was your daily goal. That was the whole office goal. So how does this happen? You watch, you schedule, and this is how this happens. Okay? Also, I would come up with a game. You'll see in a few minutes how we set these goals. And this game might be a little extra game saying, hey, guys, I got this game. If we collect this, this, and this in this first quarter, how about we all go 3 days? I'll pay. We all fly and go to Napa for 2 or 3 days. Or we spend 2 days down on the strip. Or we do something. Just a little more incentive goal. And they absolutely, the team loved it. And they were motivated. So, to continue, our goal is to pay your bills on time. I can't emphasize enough how it should be only the doctors that sign checks in office. Let's be honest and face it here. There's a lot of embezzlement that does take place in dental offices, unfortunately. Perhaps the word a lot is not the right word, but it is like as much as 35 to 40% of dental offices are embezzled. Have a practice budget for expense items. We're going to talk about that. Salary or hourly. I refer to it as salary. Salary from the aspect that I do realize the labor laws. I know that. But this is the salary that I'm going to pay you. You get paid every 2 weeks. It's based on 36 hours a week. You will punch in to make sure that you're not unfairly not getting paid for overtime. Use percentage budgeting. You're going to see that model. Meeting agenda. That's where we discuss that. Don't mix personal funds with practice funds. Share the numbers with the team. We do this daily in our morning huddle. Hey, we did $10,000 yesterday. We collected 5. I go, whoa, wait a minute. Well, we have $2,500 that went out in insurance, and so-and-so didn't have their credit card. Okay, are they going to call us? You know, we want, again, to keep score. Collections is important. And monitor all expense items monthly and quarterly. And I share that with the team. Hey, our lab bill this month was this, on and on and on. Okay, this is our supply bill. A lot of you are thinking, but I get a monthly statement from my accountant. Let me tell you about monthly statements, and I'm going to use myself as an example. First of all, I was probably 2 months later getting that information to the accountant. So if I had a monthly statement, if March ended, I didn't get my accountant until May, June. By the time you get that monthly statement, even if you get it to them the first of the next month, it may be a month and a half before they get it back to you, or a month. That's too late. You need real-time, daily measurements. You need real-time accounts receivable. Remember the saying, what gets measured improves. Only when you truly know your numbers can you begin to improve your practice performance. Early on, I said the truth of the matter is most dentists don't know their overhead. So what are some of the vitals? What are the vitals, not some, but what are the vitals that you must know in your practice? Let's take a look at them. 1, desired net income, what you need to produce to collect. I've been asked many times, how do you figure out how much salary to take for the upcoming year? I don't. My financial planner and my accountant tells me how much. Tax reasons, retirement, to cover my, I let them know what I need to cover my bills, and we go from there. That's why it's so crucial to have those tax planning and that financial planner meeting. It's critical. So how much, if I want to take $300,000 home, how much money do I need to produce to collect for me to cover all my expenses and take that home and put away $80,000, $90,000 in retirement? How much do I need to collect? You need to figure that out and set the goal. And by the way, if you set your goal to collect 1.4 million, it's okay. Fall short. 1,300,000, 1,280,000. You're shooting for the moon. And remember, it's not sad if you make it 3/4 of the way, because you really put yourself out there. Practice production per hour. Doctor production per hour. So all the production going on in the office, hygiene, doctor, is there other things that are being produced in the office? What is going on? Whitening, hygiene production per hour. And let me just say here to the hygienist, of your production, at least 30% of your production should be periodontal therapy. That is the standard. That is what we go by, about 30%. But the most important role of the hygienist is, remember, in the average dental office, I believe the figure is the patients see the hygienist 85% of the time of their visits to the office. What is the most important role of the hygienist? To re-emphasize, to create value of what we do for them, to create value for why they come to your office. That is the big role for the hygienist. Cost per hour. What's it costing you to run your business per hour? Cost and profit per procedure. I can tell you how much it cost me in an hour appointment to do a crown with temporization, lab costs, and everything. You need to know that. An exact overhead percentage. These are a lot of things to keep track of. I mean, a lot of things to keep track of. Okay? Continue. Exact collection ratio. Again, I shared the example. We did $10,000 yesterday. We only collected $5,000. That's a 50%. That's not good. What is your break-even point? We're going to talk about that. Some people call it BAM. New patients per month per year. Remember, new patients is what really, really gives the practice its growth. Not only its growth, but it keeps you going. It keeps you busy. It keeps you striving for those financial goals and your practice goals. Accounts receivable. Don't let this get out of hand. If your insurance accounts receivable is out of hand, make some phone calls. Something that's being run. Remember, the whole goal of an insurance company is not in monthly net profit. If you're treating your business like you should be, that's where your paycheck comes from. Amount diagnosed and accepted per day. I'm huge on this because if I'm diagnosing $6,000 on a day and only $3,000 was accepted, that's not a good thing. I want to hit that 90 percentile. Accepted means they have scheduled to come back either for a consultation, but they've scheduled for some treatment to be done. Now understand, I realize if you have multiple things on a treatment plan, at least that treatment plan should be scheduled to start that treatment plan. There has to be an appointment made for that to be accepted. That's a lot of things to keep track of. So how do we do this? What makes it simple? I want to share with you a way to do it with a push of a button. And I love this sign here. It says, it's not the load that breaks you down, it's the way you carry it. Again, those are a lot of items to keep track of. How do I know what my hourly overhead is? How do I know what percentage is in XYZ? How do I know what the cost per hour is? Well, there's a software program out there. It's Hello Weave. It's called Weave. Many of you may be aware of Weave. Weave is a voice over internet protocol. It ties in to your digital data in your computer software. What it does is interfaces with that so that you can keep statistics. Not only keep statistics, but watch how easy it is when there's a desktop and an app. And I have the app on my phone because I can pull up the schedule of if I want to see next week's schedule. I'm at home. I can also communicate with patients by text, letting them know I'm getting a phone call because, as we know, most people, if they don't recognize the number, they don't answer it, just to check in on a patient after a procedure. But also, the beauty of this is how it works. So you have an incoming call. Now, I've always worked with Dentrix. In fact, I did some marketing for them several years ago. Some of you might remember when I was fly fishing on the river. But it used to be if a patient called in, how many clicks did you have to perform to get to their patient record? But with Weave, the incoming call, this is what comes up. Okay, so here's Justin Moss calling in, and we can see, reminders, what needs to take place. This is what comes up. So instantly on the screen is a ton of information. Patient and family members appear. Identifying and confirming appointments. Hygiene and clinical appointments for the entire family. Who is due in? Who didn't reappoint? Who owes you money? By the way, MetLife hasn't paid yet. These all come up as soon as you answer the phone. And then there's this app that I referred to. And this on the upper left-hand corner is incredible. Patients can take the app and they can communicate with you out of office. All right? Confirming appointments. It is incredible. Weave has been such an incredible addition to our office that we know that our front desk would hang us, not literally, but they would not be happy if we ever removed it from the office. But what I talked about earlier was how do we keep track of all those analyticals? Well, here's what Weave can do. Some of the analyticals I'm going to show you here, but what they can do is by a push of a button, you get all these analyticals and more. New patient production, cancellation with unscheduled opportunities. Okay, look how much money is out there. Completed production, new patients scheduled, new patients 15, only 6 scheduled. We talk about these every morning in our meeting huddles. Hygiene reappointment, we shoot for 90%. And you get to bring up restorative hygiene treatment plan, $37,000 out. Most of you that don't have Weave or similar software, you have no idea how much is in your charts. With Weave, you can do all that. Treatment plan per doctor, treatment acceptance. I can tell you that in my offices, we average between 89 and 91%. If I'm presenting, I'm only getting a 50% acceptance rate, we have to change things. We have to change the way we're communicating with our patients. But you don't know that if you don't keep track of it. You have no idea. So Weave is a welcome addition to our practice, and it's been there for many years. I don't know that I could practice without it. So it's fantastic. Here's another example. Hygiene reappoint, 204, only 123. That's not good. What's going on? How much is unscheduled? And we can pull this up, find the patient. And a lot of times I realize that patients, they can't always schedule an appointment. So one of the first things we do is one of the person in the front will say, do you mind if we give you a call in a day, or can you call us when you look at your schedule? Because doctor wants you to have this completed. It's rather urgent. And we ask them permission to call them or to have them call us back. It has to be done within a few days of them leaving the office. So we do realize that a lot of times they don't know their schedule. But you look at, take action, reach out, fix it today. How much is unscheduled? There's no appointment made. So hello, Weave. We love it. And something new is Weave Pay. It's actually about 8 months old. And it's fantastic because what we can do is text the patient on Weave and say, Mrs. Jones, your insurance paid. That's a good thing. And there's a $50 balance. Would you mind if I run your credit card on file today for that $50? And therefore, you don't have to send a statement. I will tell you, and this may come to a shock, that each statement you send out can range between $9 and $14 depending on the office. So you think about not only the time and the lack of efficiency of sending that out because that person can be doing something else, but take a look at Weave. And oh yeah, by the way, you can get rid of your local phone company, which not too many of us love anyway. So one of the things I shared for you, as I showed you that picture, was my father was a very strict Italian business person. And I'm thankful now. Believe me, when I was growing up, I go, oh boy, now what is he doing? He's killing me here. I don't want to be doing this. I don't want to be working in this business. But believe me, not only did he become my best friend ever, but he taught me so much, and I didn't realize it at the time. I do now. So first rule, you do not spend more than is coming in. I realize that's not maybe the American way or the world way, but trust me when I say this. Remember, I told you one of the greatest stresses is a financial stress. If you are out there spending more money than coming in. That puts so much pressure on you to perform in your practice every day. That puts so much unnecessary stress on you. As the owner, you are the last to get paid. I shared that with you earlier. Plan for retirement immediately. I don't care if it's $10 a week. I don't care what it is. Think about compounding interest. Think about financial planning. Think about how they could take it. Just plan for retirement and start. You young dentists out there, I can't tell you to start. And I realize I'm not naive that you may have some debt, but find a way. Decide to give something up to put it in retirement. When I was in 5th grade, I was at my desk in my bedroom one of the few times I was studying, I have to tell you, and I had a chalkboard, and I never erased this all the way through high school. It says, cash is king. And that's the truth. Cash is king. And that is $1 in my pocket. It's much better than $1 in anyone else's pocket. We're going to talk about negotiating costs with your supply people who are absolutely my partner. They're such a huge asset to our office. No credit card debt. My father lived to the age of 67. He didn't have a credit card until he was about 64, 65, and he started traveling. Everything was cash. Credit card debt, interest on credit cards, they love it. It can kill you. So let's take a look at some guidelines. This is the percentage budget modeling that I love to talk about and present. And hopefully, you'll take a look at this. And I'm going to take a few minutes, and you may want to pull out your camera again, or you may take a picture of this. But we're going to talk about this. Make 4 columns: the overhead, U, average, and ideal. So U is your particular overhead in the item we're going to talk about. The average is the national average, and ideal is how do I get to 55%. So team, the average is 30 to 35%. The team's salary, hourly, the cost, their salaries, your payroll sheet that you get from either the ADP or whoever does your payroll, if you do it, it includes everything in that payroll. FICA, FUTA, state income. That, okay, ideally should never exceed 20%. The national average is 30 to 35. Remember I said that if you're one of the symptoms of an office out of control financially is overhead of 67% or greater, this is where that comes from. This is the crutch right here, the team salaries. Now, I'm not saying that it's the team's fault. When I have gone into most offices and their salaries, I gave a lecture in Hawaii at lunch, right before lunch, as we were going out, a dentist came up to me and says, "Can I have lunch with you?" And I said, "Sure." My wife and I are having lunch, and I'm giving an afternoon lecture. He says, "My team salaries are 43%. I said, we need to talk. So what I found is, one, either there is a lack of efficiency in the office, or most of the time, there's a ton of dentistry to be done that will get this down to 20%, or the fees are not right, and you should be adjusting them annually, because a 2020 F-150 is not the same price as a 2019. So cost of dentistry goes up, labs go up annually, or there's just not enough dentistry being diagnosed. So that's usually why that is at 30 to 35%. Lab costs, 8%. I love it when it's 10% or greater, because that means we've done a lot of crown and bridge, and I absolutely love it. Rent, 3 to 5%, and that's negotiable with your landowner or yourself as the owner. Equipment, 3 to 5%. At the end of the presentation, I'm going to try to convince you why you should buy a CBCT. Office supplies, 2%, ideally. Average, 1 to 2. So you can see outside of the salaries, everything is pretty much in line with ideal. Marketing, the average office does no marketing. Now, marketing can be 2 ways, external, internal. I prefer, in fact, I kept statistics for well over 30 years. I prefer internal marketing. Remember, and this is well known, over 65% of the patients, new patients that walk in your office is by word of mouth. So you want to make sure that your patients know that you're accepting new patients. The physicians have kind of heard us on this because, you know, a lot of patients are under the understanding that, hey, I can't get in this doctor's office to such and such. An example of that here in Las Vegas is try to get into a dermatologist within the next month. But anyway, make sure your patients know that you need new patients. So we do marketing, we do a website, have a video on your website, have a testimony on your website. So obviously, the age that we live, websites are important. So 10% in miscellaneous, I left that blank. This is how you get down to 55%. Again, the national average, 75 to 78. So where do we go from here? Well, and this is monthly, okay? So I'll leave that there a second, but I'm going to come back to it, so not to worry. Here's an example. So right now, if you have $1 million practice, and what I mean by $1 million practice, you collect $1 million and your overhead is 75%. That leaves a net of $250,000. With a 10% drop in fees, and again, if you have PPOs, excuse me, now may be the time to perhaps drop those to get an in-office dental plan, whether it be Clear or your own. And we have one at University Dental Professionals that Dr. Graham and the team came up with. And if you go to udpdentistry.com and click on financial options for patients, and then click on UDP prevention plan, you will see the plan we have in the office. But with a 10% drop in fees, and if we take just what we're going through this COVID, we will each of us have well over a 10% drop in fees in collections. Then what happens, let's say that your practice with a 10% drop in fees only collects $900,000. Your overhead, 75%, you net only $150,000. Now, as the dentist, as the leader in the office, your salary comes out of that. Your salary comes out of that net, and we all know we have to leave some money in the practice to pay bills. So you have a 40% drop in net income from $250 to $150. However, if you take $1 million practice whose overhead is 55%, you net $450,000. That's why the difference, a 20% decrease in overhead from 75% to 55%, increases your net income by 80%. Please take a look at this. Write this down. Take a photo of this. If you remember nothing else from this presentation, please remember this. Okay? Now, I hope the teams are ready and excited about this. We're going to talk about bonus and break even. Okay, doctors, I know you want to kill me right now. But guess what? I'm going to show you the easiest way to motivate your team, to motivate yourself, to be the best dental office, to just have so much fun. And I love this. I love this slide. It says ways of saying no. Nope, I'm not listening, whatever. But you can do this. It is the easiest, the best bonus system that I've ever seen. Let's go back to our model. Remember I said that the team's salary cannot exceed 20%. So if we take that and calculate the even point, is it based on or production? Always. Everything financially in the office is based on collection. You know, I heard this saying one time, you can't spend production. That's true. So if employee salary equals 20%, that's a factor of 5. In other words, 5 times 20% is 100%. Simple math. Just for an example, let's say that the monthly salaries in the office are $20,000. That means the break even for the month is $100,000, because if your salaries are 20%, pretty much everything else is going to fall in line, okay? Now, remember I said there's a lot of things negotiable in that budget, and I apologize, I'm bringing it up now. If you go to any of your dental rep, and again, I can't tell you how important they're an asset. I realize you can buy things online. I realize that to save money. But trust me, if you sit down with your dental rep and say, I want to get all my supplies for 5 to 6% of my budget this year, they will make that happen. They'll work that out for you. Plus, you need them. If you're not an A-list for your dental supply person, then when you break down, you're not going to get A-list treatment. They're going to take care of those doctors that take care of them. So I can't emphasize how, not only for that reason, how important they are to us. Have a good relationship with your dental supplier. So the break even is 100,000. So we figure our bonus on quarterly. We don't figure it on monthly because you could have a bad week one week. I could be out of the office one week, whatever, or someone's on vacation. It's figured quarterly. So 3 months in a quarter, that means that the break even point is $300,000 for that quarter. 20% of anything collected over $300 goes to bonus, divided by the number of team members, thus each team member's portion. So let's take a look of an example. Say you collect $420,000 in a quarter. Your break even is $300,000. That's $120,000 over break even. 20% is $24,000. $24,000 is the bonus for the team for the quarter, divided by the number of team members you have. In my case, I had 3.5, 4. Each team member gets $6,000. Now, if you want to talk about a way of motivating a team, and believe me, the benefit from you, and yes, you do have to pay taxes out of this. You have to run it through payroll. You have to get that. But the amount of financial advantage for you as the doctor is incredible. It's motivating. You keep team members for a long time, and they will love to come to work. They will love being with you. You are their shining armor. So 6 ways to increase production in the office. What are they? 1, increase the number of patients you treat. 2, increase revenue generated per patient. What are those procedures that generates more revenue for you in the office? And the key to that also is block scheduling. Increase fees charged per procedure. I can't emphasize enough how important it is to increase your fees yearly. Yearly, please. Patients, if you have the right relationship, they trust you, they're not going to leave. They know cost goes up. And it's going to be tough going back and doing this because one of the questions is how many people are going to be able to jump back into doing some of their dentistry. Always present comprehensive treatment plans. There are many times that a new patient will come in and you have a long list of treatment that you're going to recommend. Bring them back. I can only recommend, you be the judge, but you don't want to blow them away. Bring them back. Not only bring them back, but bring them back with their significant other. I can't emphasize how important the significant other is to see the value that you're going to create about the treatment that you're recommending. If you don't have that significant other there and that patient goes back and says, hey, I need XYZ amount of dentistry done, they don't get it. And that's a fact. Quadrant dentistry, especially when we're going back with this COVID. Try to do as much dentistry, fewest patients until we get through this virus, as few patients visits per day. Try to do as much dentistry on one patient as you can. I always want to do, if I have to give a lower block, I want to do all that dentistry on that block if it's possible. And schedule 10-minute increments. No one should be on 15-minute increments. Hopefully that's gone in all our offices. So this is 6 ways to increase production. 6 ways to grow your practice, a little different. Increase your number of new patients. We talked about that. That is one similar. Increase your capacity to do more dentistry. Perhaps add a room. Perhaps add a hygiene. Set up another hygiene room. Maybe you're busting at the seam with hygienists. Perhaps increase your number of high profit procedures. After you go through and you realize and you got block booking them. What we mean by that is block it off, and you have new procedures. Maybe you're going to be doing some Botox. Maybe you're going to be doing different crown and bridge. Maybe you're going to have a CEREC. I'm going to talk about in a few minutes the amount of dentistry you're going to see that you can provide from a CBCT. Increase your case acceptance. Once you start keeping track of that, if you're not, you're going to see how you may have to change the way treatment is being presented and who does that presentation. You know, my team never wanted me to talk about money necessarily because I love what I do. And they said, you're just going to give it away. Well, we do give a lot of dentistry away for those people that need it. That's part of being a professional. But increase your case acceptance. And an in-office membership plan. Is it time to drop that PPO? Again, if you go to our website, udpdentistry.com, and click on financial options, and then click on UDP prevention plan, you'll see our in-office. Or you can submit to Clear. Clear is a great plan. If you don't want to administrate this, and I understand that, but I guarantee you, this is for those patients that do not have dental insurance, and there's a lot of them out there, and we know that dental insurance is on the brink. Is it going to still be there or not? This in-office plan, Clear or whatever you come up with, is fantastic. And take a look at that. Be creative in your patient financing. Don't become a bank. We are not bankers. Whoever came up with the idea that patients can pay so much per month, we are not banks. If you look at what $100 is today versus 90 days from now, and remember, people that owe you money will always find fault in your work. That's very well known. Don't be a bank, please. Patients love high tech. They really do. I talked about Weave, CAD CAM restorations, digital x-rays, caries view, carie detectors. Take a look at some of the studies about detection of interproximal decays. There's a lot of studies that show x-rays and digital x-rays are only about 49% proficient. Take a look at caries views, caries detectors. Digital Doc just came out with a new camera that can do all three of these. Take a look at that. CBCT, notice I have an asterisk around that. We're going to talk about that in just about a minute. Intraoral scanners, intraoral cameras, show them the dentistry. You're going to do cold diagnosis, oral cancer screening, lasers, and of course, video on website that I mentioned earlier. There's no question about it that today's practice has to be focused on embracing technology and integrating it in efficient workflow. As I mentioned earlier, I graduated in 1980 at University of Michigan. I was there for 11 and a half years. I had the opportunity to teach histology in a medical and dental school, and then go to dental school. And I loved it there, but I also loved getting out and going to private practice. And if I think about what we had to know in 1980, I mean, just the materials alone, let's take a look. I had to know about zinc phosphate. I had to know about amalgam. I had to know about some other cements. There wasn't a whole lot I had to know about. But if you look at just materials today, you almost have to have a PhD to keep up. And thank goodness that our manufacturers have given us such incredible, when I do a course on materials review, it changes. And it's exciting for me because I have to keep up to do the presentation. But now you look at the digital transformation, about the scanners, how I can send an impression to my lab, and it's there in California, wherever I am. It's miles and miles away before the patient walks out the door. It's amazing. It is absolutely amazing what we can do and what we can see. So the relentless onward march of an advanced digital technology in dentistry, it's a fact of life. Remember I told you, if you don't change, change will change you. This is what I'm excited about in dentistry. It allows me to make a proper diagnosis and present the best treatment that is possible. Several months ago, I was doing a presentation in California, and I was asked, if you were to buy or make sure you had one new digital piece of equipment in your office to help you increase treatment, what would it be? And I said to that person, can I have two? They said, all right, you can have two. I said, there's no question about it, a CBCT and intraoral scanner. And I've learned this just in the last 3 years about the importance of a CBCT. In our office, we do not take FMXs anymore. We interview the patient. If it's an emergency, we take cone beams and take vertical bite wings. And I'm going to show you that setup. Why? Because there is something out there that will give us a better diagnosis, more information, less radiation than we will with an FMX. So a cone beam has radically transformed, the way we as dentists can gather information, with results being an ability to diagnose and treatment plan in a manner that previously could not even be imagined. It makes a dentistry affordable. It's a means of elevating our diagnostic skills and presenting it for treatment to the patient. And I'm going to give you an example. And here's a question. I had to pose a question before a presentation a few weeks back on cone beam. As a general dentist, what is more frustrating? I want you to think about your setting in your office. When you take a 2D x-ray and you look at it and you are guessing, or you're not sure, and guessing may be a harsh word, but you're just not sure what the diagnosis is that frustrating? You have to refer them to a specialist, or you have to refer them out for that x-ray. To me, that's very frustrating. When I perhaps could have diagnosed and performed the treatment or informed the patient as to what the best treatment plan would be. We have many choices when we go to do our radiology, We have Panorex, we have full mouth series, we have bite wings, we have periapicals. But let me just share with you, this is our setup for a new patient. Again, we interview the patient, we ask them certain questions. First thing we do is take a CBCT. Why my assistant is taking an intraoral scan and vertical bite wings and perhaps some PAs, I'm reading that CBCT. Now don't get nervous about reading the CBCT, because I know you're thinking, what if I miss something? If there's any question, we send that CBCT out for $75 to Beam Reader or some other oral radiologist expert and have them read it. But that's very few times, because you have the knowledge right now to read those. And I will tell you, for instance, we have Prexion in our office, and I know Dr. Graham has gone through them. Prexion is by far, my opinion, the best out there, no question, because of their education, their warranty, and they're always there for you. And it's so easy to learn that it's incredible. So this is where I do my exam and present it to the patient. It is so easy to present treatment when you can take an intraoral scan, show them different scans, show them those breakdowns, show them their cracks, show them abfractions. It's co-diagnosis, and they go, I want this taken care of. And that's the truth. So this is a patient. She was a student at University of Chicago. She had an accident, and the doctor, the prior dentist, fixed her teeth. She broke off some teeth. She had a couple of veneers on 8 and 9. And it was a doctor in our practice that no longer was there. And it was our understanding she was having her teeth cleaned by her dentist at home. She lived in in Iowa. And so she said, no, I would like my teeth cleaned. So I noticed that I didn't like this swelling on the anterior, so I had the assistant take this PA. Now, there's no question that we see a little periapical lesion there, and perhaps, but you don't know. You're guessing. You are really guessing. Took another, because of that PA was foreshortened, she had to take another, more radiation. And this, you can see right here, what is it? Well, we don't know. Is that anatomical? But also, is that something right there? I'm guessing. I am guessing. It's like flipping a coin. There's no question. So I want you to think about this. In dentistry for the past 100 years, maybe in your career, whether it be 5, 10, 1, 20, 40, how much have I been guessing in regarding diagnosis? When I say guessing, I'm not sure. I cannot make a definitive diagnosis and make a treatment plan. So thus, we take a CBCT, I take my axial view and blow it up, and lo and behold, what do you see? Resorption. Now remember, the past history, there was trauma. We see resorption. There's no question. Had a conference with our periodontist and endodontist in office. The decision was made we could not save the tooth. And if you look here at the sagittal view, right here, you can see the abscess. But the good news is from this, we can also see we have buccal plate, thus an implant can be placed. It broke my heart to tell this 22-year-old, beautiful young college student we had to do this, and then a phone conference with their parents. But there was no way from that 2D. I can only emphasize that this is just one example. Another example, patient comes in, new patient referred by her sister, patient in the practice, having pain and discomfort, brought in a FMX, and I'm only showing the upper left PA. Dentist, I don't see anything for previous dentist. And can we make any diagnosis off that PA? Absolutely not. Like flipping a coin, we're guessing. We have no idea. Where's the paint? We don't see anything. Lo and behold, CBCT, resorption, trauma. Who knows what it's from? But we can see. Now we can make a diagnosis. Now we can inform the patient what is best for them. These are just two examples. Why do we take a CBCT? Because of this. It gives us the most information that we can provide for our new patients, for our existing patients, and we can make diagnosis and treatment plans. Let me tell you, a lot of times I'm asked by dentists the return on my investment. You will be able to treatment plan so much dentistry. And it's not about so much the return on your investment. It's about providing the best service. It's about being able to give that patient the definitive treatment and being able to treatment plan. These are just a list. As a GP, I do a GP course on CBCT of GP things that if you're doing endo, ortho, if you're doing implants, not having a CBCT. Florida and California just came out with the standard of care for placing implants is a CBCT. They're just the beginning, and they're the two of the largest dental associations in the States. If you're doing any of these, I can't emphasize how important a CBCT is. So the benefits of a CBCT, the ability to see more, if you more, you mistakes, your treatment will be the opportunity to do more. Thus, one of the ways to increase production, I can't emphasize enough, if you don't have a CBCT, give Prexion a call. I love them. And again, if you're not sure who, be sure to email or phone to me. So I have this saying that I always talk about. One who works with their hands is said to be a laborer. One who works with their hands and mind is said to be a craftsman. One who works with their hands, mind, and heart is said to be an artist. This is a saying that was said by St. Francis of Assisi. And I want all of you, and I want all of us as dentists to be an artist. I want us to work with mind and heart of what we do to get financial stress. And hopefully this presentation has given you that opportunity. I also talk about heroes in our life. Right now, what we're living through, this pandemic, these people are heroes. They're putting their lives on the line. Unfortunately, I watched the morning news today, and a nurse, she videotaped her life after she contacted COVID-19, a single mom of two boys, 16 and 23. She videoed to the day she passed. And we think about those families that have lost loved ones, those nurses, those doctors that are out there providing for us to find a cure. And we can only pray and hope that cure is soon. 9/11, look how strong our country was. We came together, Boston strong. In October 1st of 2017, unfortunately, here in Las Vegas, there was a Route 91 harvest, and most of you are aware of the consequences that 22,000 people, 58 dead. Unfortunately, our next door neighbor, a single mom of 3 boys, didn't make it. That hit home for us. Yet Vegas came back strong. We miss our neighbor. We miss those people. Our hearts go out to those. But again, keep it positive. We'll get through this. We all are in it together. We will get through this. And may God bless you all. One day I was sitting at my desk, and I think all of us, we get down once in a while. We think about, woe is me. But we all are so blessed, and the greatest professional is the opportunity that we have, how we've been blessed with the skills and everything. And I thought to myself, I have no right to complain. You know what? There's been a lot of price paid for what I'm able to do. So just like when you see servicemen, servicewomen, service people, and you thank them for their service, again, remember those that are servicing us right now, and be thankful for where we live and what we do and what we're able to do. Thank you. And this is my email. So it's time for, let me pull this up here, questions and answers, okay? This employee report is based on previous year wages and benefits. Let me pull this up. It's, yeah, it is. The employee's annual compensation report, if you're referring to that, is based on the previous year's compensation. Yeah, so when we go into planning, like if we are going into planning 2020, obviously I'm giving them their annual compensation report from 2019. Can you use, Victor, can you use it with Dentrix? If you're referring to Weave, absolutely. You can use it with Weave. We have Dentrix. You can use it with Weave Eagles Up. It's amazing. Do you have to open another app or software to get the information? No. As soon as you answer that phone, that information comes up. It's great. I'm telling you, it's fantastic. If you're talking about the analytics are right before you in the Weave app, either on your phone. And remember, why do we verify appointments? It's all on the smartphone. How many people don't have smartphones? I do this when I do this lecture. By the way, this lecture is usually live. I'm usually visiting somewhere, and this is a breakout. We have, we do a breakout. It's a hands-on, and we have fun. We laugh. We make fun of each other. We just have fun. We don't make too much fun of each other. You guys make fun of me. That never bothers me. But we have a lot of fun. And I show them, I make a phone call, and let's say that one of the features of Weave is, let's say that you're on the phone with someone and you can't answer a phone. As soon as that person, remember, here's the figure, everyone. Over 90% of new patients that call your office, if the phone's not answered, they will not return the call. So as soon as they hang up, a text goes out and says, hey, this is Mary Lou. I'm on the phone with another guest. Please give me 5 minutes and I'll get back with you. It's fantastic. Do you have to, can you please share the overhead slide again? Okay, I'll do my best. Do you use a company to manage your membership plan? We have ours in office, but we also use Clear, okay? David Monahan that designed Clear is a fantastic guy, great company. And if you don't have time, I mean, Clear is great. It takes it, the responsibility, well worth it. Again, for those patients that don't have. And do you charge annually or offer monthly payment? Ours is annually. One of the things we're looking at is, because we're right at the University of Chicago, is those students that don't have insurance is looking at it a quarterly or monthly payment. So it's a good question. But right now we do charge annually. We are looking at monthly. Everyone, please get a CBCT. What do you recommend? Okay. Have you gone through process of going out of network with insurances? I am not in any insurance network. We do have some doctors in network. One of the things that we are considering, Lindsay, let me make sure. I'm not sure what her second part of her sentence is. One of the things we are considering is that if these in-network insurance companies, you can't do business and lose money. One of the things that a lot of doctors, unfortunately, think about is, I'll make it up in volume. If you lose $5 on a procedure on one patient, you're going to lose $10 on two patients. So you can't make most things up on volume. So, we're waiting to see for those doctors that are in network what these insurance companies are going to do. Second from the bottom, it's have you gone through process of going out of network with insurance?
Oh, okay. Yeah, is there a best way to do it?
We always tell patients, I'll give you an example. If you take MetLife and you're a doctor that's out of network and a patient calls in, we tell the patient that we accept MetLife, but we're not in network. Okay? In other words, what I mean by that is we will see MetLife patients, but we are not in network. That's the way I should have said it. And again, everyone, thank you. for taking time. Hopefully this presentation will, if anything, stimulate some thought. I appreciate the evaluations and any positive thoughts, any negative, anything that you would like to see different. I've got broad shoulders. I've done this a long time. And if nothing else, I hope to see you in a live lecture down the road, and have a good evening.